The U.S. now has more COVID-19 infections than any other country in the world. It's safe to assume that your life has changed a lot over the past few weeks. But exactly how it's changed really depends on where you live.
At this stage, as a nation, we're in essence functioning almost as 50 separate nations right now.
This is Boris Lushniak. He's one of the world's leading experts when it comes to pandemics.
Almost every big public health event, I was honored to be called into service in one fashion or another. The World Trade Center, the anthrax attacks, Hurricane Katrina, the H1N1 pandemic influenza of 2009, and then as commander of the Monrovia Medical Unit in Liberia in the midst of the Ebola epidemic.
But the coronavirus has him really worried.
My fear is unless we take this much more aggressively, we're going to see further spread. Once we overwhelm the medical care system, then all hell is going to really break loose.
Here at Newsy, we've been tracking every day how cities, states, and the federal government have responded to COVID-19, and how that's affected the lives of people like you. One month after the first confirmed case of COVID-19 in the U.S., on February 29th, Seattle and King County announced the first COVID-19 death in the country. Governor Inslee of Washington declared a state of emergency. On March 3rd, according to Johns Hopkins, there were 77 cases of COVID-19 in the U.S., and the CDC announced finding more evidence of the virus spreading, not by travel from outside, but within our own borders.
You might see some local communities taking specific actions to mitigate the disease. What these actions look like at the community level will vary depending on local conditions.
The next day, California and Hawaii declared states of emergency. By the time President Trump declared a national emergency on March 13th, more than half the states in the union had already declared their own.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Two very big words.
Messaging from the president matters. Before the declaration, a handful of states had announced they would close schools statewide. Several days later, only a few states allowed districts to stay open. This is when America started shutting down, piece by piece. Lushniak says at this point, what the country needed was one clear plan for containing the virus.
Which is, do we all tell people, listen, if you can work from home, stay at home as much as you possibly can. Here's sort of the essential activities that we'll allow, right? And here's other things that really are thought of as optional.
Instead, we saw a steady stream of announcements of various directives by state and local authorities. On March 17th, the governor of Nevada closed all non-essential businesses, including casinos. And on March 19th, California's governor was the first one up them, closing businesses and ordering residents to stay at home as much as possible. COVID-19 policy has been a patchwork, left to 50 states with 50 different ideas on when to take drastic action to protect their communities. And it gets even more complicated. Some cities and counties have made their own orders when state lawmakers haven't. But to public health experts like Lushniak, this has been the wrong approach to containing the virus.
I would prefer that we do this as a unified front as opposed to having every single jurisdiction trying to make decisions about this. The virus doesn't know international boundaries, nor does the virus know state boundaries.
Take Tennessee and Kentucky, for example, neighboring states with very different policy responses. On March 16th, Kentucky Governor Andy Beshear shut down all bars and restaurants for in-person operations. But Tennessee left theirs open for another week. This left Governor Beshear in the position of begging Kentuckians not to go to Tennessee.
If someone does decide they want to go out to eat and goes to a crowded restaurant in Tennessee, they bring back that coronavirus here in Kentucky.
And finally, banning all non-essential travel out of state. If the virus doesn't know borders, then the best solution is also one without borders.
Our country is in the midst of a great national trial, unlike any we have ever faced before.
It wasn't until March 31st that the president told Americans without nationwide community mitigation, hundreds of thousands more lives could be lost.
If we really followed the rules, right, the whole rules of social distancing, of sheltering in place, and if the whole world did it, right, it would be within 14 plus days, right, and if we took care of all the people who are ill, we could put an end to this rather quickly.
We're going to keep tracking how communities are responding to this crisis and how life across America continues to change. Keep an eye out for future coverage. Rosie Chima, Newsy, Washington.